All right, so welcome everyone to today's webinar is going to be about our gentle detox reset. And this is based off of Dr. Dietrich Klinghardt. He is, I believe he's German, and he's been around forever in the integrative medical space, functional medicine space. He was practicing functional medicine before there was even a word for it. And his area of specialty is chronic Lyme disease, mold mycotoxins, chronic inflammatory syndrome. So he's seeing like the worst of the worst types of cases. So this detox, when we learned it in Austin, when Kristen and I went to the conference on chronic illness, he presented a lot about this. And what I really liked about it is it's very gentle. He uses it with his most sensitive patients. So that's why I felt this made a good protocol to share with everyone, because pretty much no matter who you are, you're going to be able to do this safely. And like even the chlorella, for instance, is safe in breastfeeding. So pretty much no matter the situation, it's going to be tolerated by almost everyone that is participating in this. So again, welcome. And one of the things that this also kind of aligns with in terms of what we do here at Peak, it's all about supporting the body at the cellular level to restore balance and help your body recover. Because if we can make the cells healthier, those cells make up our tissues, those tissues make up the organs of our body, and then organ systems, and then ultimately the organism, which is us. So if we can make those cells healthy one by one, and our body's constantly turning over new cells. So liver cells last only in the matter of months, and other cells, skin cells, might last even less than that. Red blood cells, for instance, last three months. So as new cells are being born, we want to create environments that is conducive to having healthy cells being born. It's almost like with like when a woman gets pregnant, we know that first trimester, those first couple months of pregnancy is vital, because that's when that little ball of cells is first forming that fetus. And we're super careful about making sure that mom's not exposed to anything toxic. There are no medications that could interfere with the pregnancy or harm that fetus. But then when it comes to our cells that are being basically born in probably the millions every single day, we don't think about it quite so much. So if we can provide an environment, and that's total environment, so that's what we're being exposed to psychologically, stress-wise, that's our nutrient levels, and then in terms of what we're talking about in this webinar, toxins. If there's a lot of toxic exposure, toxic burden in the body, then those cells are being born aren't going to develop in the way that they should, and they might not function at as high level as they should. So that's why we want to make sure that we're supporting our body from that cellular level up. And so why does detox matter? Detoxification, why are we detoxing at all? And it's because we're being exposed to so many things. And I was just talking to someone here in the office. Yeah, the plastic bottle that we drink out of, that we get at the gas station, might not be a huge deal. I mean, it's only a little bit of water. It's a one-time thing. But when you put that in perspective and in context with everything that we're exposed to. So it's not just that plastic bottle where we're getting exposed to plastics, for instance, it's in our clothes. And yeah, maybe not a whole lot travels through the skin from wearing a shirt, for instance, that is made of polyester or some type of synthetic material. But it's a little bit on top of the little bit we get from the plastic bottle, on top of the little bit that we get when our food is microwaved in a Tupperware, plastic Tupperware, on top of the plastics that we're exposed to just in our normal drinking water, because not all that stuff is completely filtered out, on top of all the other exposures, whether it's through health and beauty products, whether it's the Glade plugins that we have to help with deodorizing the air, covering up scent. And it's just a little bit of everything all over the place. And that's just mentioning plastics, not to mention things like pesticides, herbicides that are sprayed on our lawns, and things like golf courses. There was just a report that came out this week that if you live within a mile of a golf course, you have a much higher risk of developing things like dementia and Alzheimer's, which I live within a mile of a golf course, so that kind of worries me a little bit. But there's just so much out there that can affect us. And our body is designed to handle that stuff to a point, and it has systems in place to help detoxify these things out of our body. And some people will argue, I've seen this kind of like these TV doctors that are skeptics will say like, our liver detoxes, why does it need any help? And that's what our liver's for. That's what our kidneys are for. And these detox programs are ridiculous. But I would counter with, well, our kidneys control our blood pressure, but yet people still get high blood pressure. our pancreas and our body's insulin and blood sugar regulation system is supposed to manage our blood sugar. That's a function of the body, but we get sick and we develop diabetes where we have high blood pressure and we need to take medication to manage that. So, yeah, our body's supposed to take care of a lot of these things. But when we overburden it where it can't keep up, or as we start to age and our body doesn't function quite as well as it used to, or if we add in all sorts of other things like stress, poor eating, I mean, you name it, eventually gets to the point where the body becomes overwhelmed and needs a little bit of help. So that's where this detox program that we're talking about in this presentation is going to help give our body a little bit of support to do that. So what are signs that we're toxic? I mean, you can just do like take inventory of yourself, your diet, your lifestyle, and if you're being exposed to a lot of the things that I've already mentioned, chances are you're at least beginning to become overloaded. But especially if you're having symptoms like fatigue, brain fog, hormone imbalance, like a lot of these things like plastics and pesticides are hormone disruptors. If you have things like headaches, skin issues, they say skin's one of the biggest detox organ or is the biggest detox organ in the body. So oftentimes when your body's trying to get rid of stuff, it'll come out through the skin and cause skin irritations. Then we have the digestive tract with bloating. You might have joint pain and inflammation. Maybe you get sick more often. So these could all be red flags that your body needs a little bit of help in detoxing in these areas. So when we're looking at a detox program, we need to look at why some people like fail at them. And sometimes it's just depending on the program. Now, sometimes these things are necessary. You need to kind of work your way through it. But again, in a detox like this, we want it to be very gentle. And if it's too aggressive, you're going to feel worse and maybe not continue it or not follow through with it. If there's no support for drainage or elimination. So like if you're detoxing and whatever you're following, you're just not moving your bowels enough, you're not sweating, you're not urinating, you might be mobilizing and moving the toxins around your body, but there's no way for them to escape. So we want to make sure that we're eliminating really well. You're drinking enough water and you're urinating on a regular basis. You're moving and sweating. You're having daily bowel movements. So we want to make sure that we're opening up those pathways to elimination. So if you start taking these supplements and following the recommendations we're going to go over in this webinar, and you're not moving your bowels or doing that on a regular basis, then certainly reach out and we need to solve that problem because we don't just want to move things around and trap them with the chlorella, with the binders. We want to make sure it's moving out of the body. And then that's why some other programs I think are suboptimal in my opinion is if they don't have binders, you're moving that stuff around, but it's not binding to anything, getting trapped and then being carried out of the body with a bowel movement. And a lot of times too, I'll see like a 2-day detox, a 3-day detox. That's great every once in a while. And if you don't have any major symptoms or issues, a 2 or 3-day detox, and usually they're not detoxes, they're colon cleansers. So it's usually a combination of laxatives. Maybe there's a binder in there as well. But yeah, that might clean you out and that might be good for that short term. But if you have a large toxin load in your body, especially, you want to follow it for probably several months. So if you're following this program, taking the supplements, and you notice that you're seeing some improvements, this may be something you want to follow. Maybe not in the higher amounts that we're going to escalate to near like weeks 4 to 6 of the program, but even taking it once a day at the lower doses for several months might be the ticket to continue to help your body and support your body in detoxification. So we have 3 steps for this particular program, and there are 3 supplements. So I like to talk about these because if you understand the mechanism, then it's easier to stick to it and follow it. So the first one is to open up those detoxification pathways, mainly in the liver, using those broccoli sprouts extract. And you can also eat other cruciferous vegetables. So it's broccoli, cauliflower, cabbage, Brussels sprouts. And all of those contain compounds called sulforaphanes that help the liver neutralize and clear out toxins. And it converts them into something that's less toxic and converts them into a form that then gets into your gallbladder through the bile and then ultimately into your digestive tract. And then if there's something there to bind it, which could be fibers from our foods, or using step number 2 here, the chlorella, it binds with that and then gets carried outside of the body with a bowel movement. So that second step is the chlorella. Chlorella is a relatively safe binder. So sometimes we get binders that are a little more heavy duty, like activated charcoal, for instance, or there are prescription binders that some people will take for more severe like mold and mycotoxin illness. But the problem with a lot of those are, especially when taking long term, is it binds with everything. So it's not just binding with toxins like heavy metals and plastics and mold and mycotoxins, but it'll bind with your vitamins, it'll bind with medications, it'll bind with nutrients that you're eating with your foods and taking with your supplements. So taking some of those stronger binders, they're okay short term and in certain cases, but it's tough for them. It's not really great to take them long term because it can ultimately lead to some nutritional deficiencies. And so we like to use Chlorella because it's a relatively, we call it a smart binder, where it's not going to bind with nutrients, but it'll bind with things like heavy metals, with plastics, etc. Chlorella is it's a good binder, and one thing we got to be careful though when we're using any binder is, does it come from a clean source? Because if you collect chlorella that's cultivated in an environment that's toxic, so if there's heavy metals in the air, or the rain's polluted, or it's next to farms that have pesticides, herbicides, etc., the chlorella will bind with that as it's growing, and then you're taking something that's basically already bound with toxins or can release toxins and make things worse. So Dr. Klinghardt recommended the brand. They tested several different brands, and he found that the BioPure that you all have, or that you might have if you're watching this and you're gonna get the supplements after the fact, the BioPure is a clean source, and they've had some pretty good success with that. And then step three is to mobilize those deeper toxins and the things that are normally a lot more difficult to get rid of out of your body. And in this case, I'm talking about heavy metals specifically. So things like mercury and lead. And the cilantro will help move that around, and then gets in through the liver, where the broccoli sprout and other sulforaphane that we eat through our diet will help neutralize it and turn it into a form that's less toxic for the liver. And then it turns it into a form that can then get into the bile and then out in the digestive tract to be trapped by the chlorella. So that's that three-step process. So here, and I have slides for each one of these, but we have the broccoli sprout extract. And for those of you that want all the gory details, it activates something called NRF2. And then it also supports glutathione, which is called the master antioxidant, and is involved in that phase 2 liver detoxification. So we're going to start with that first to get that part of the system working. Start with 1 cap daily and then gradually increase to 2. And then next we have the chlorella, which is a binder to those toxins. And we're going to start with 5 tablets twice daily and gradually increase to 20 twice daily. Don't worry if you already have them at home. You'll see that they're very small. And those could either be swallowed as is, or they can be blended up into a smoothie. It'll turn a smoothie bright green, but it doesn't really affect the taste too much. And then the last one is that cilantro extract. And you can actually use, if you like cilantro, if you like making guacamole, or you like making your own salsa, lots of cilantro, eating the food source is going to do the same thing. And then this we're not going to add until week 3, because we want to make sure those first 2 steps of detoxification are working smoothly. And if you do have a high toxin burden, we want to make sure we clear some of that out before we start mobilizing more toxins and heavy metals, in this case with the cilantro extract. And then it's not just all about the supplements too. I mean, they'll still work. The binder will still bind things. The cilantro will still move stuff around, chelate those heavy metals, move those heavy metals around. The broccoli extract will help with phase 2 detoxification in the liver. But to make this even more effective, you want to participate in some of these daily habits. So you want to hydrate really well. So half your body weight in ounces per day. So you weigh 160 pounds, you want to try to get 80 ounces a day of water. And then I'll make sure you have enough to help things move through your system, because there's essentially, well, we'll talk about that in a second. So the next one is sweat. So you can do a sauna if you have access to that. You can do like a hot bath, soak in the hot bath, or especially on a warm day, just get out and get moving and sweat during exercise. Moving daily will help too. And the reason why this works is not just about sweating, but it's also moving the muscles and help getting that lymph to move around our system. So like we have our blood vessels, we have this other like system outside of our blood vessels called the lymph system. And that lymph system takes junk that the cells produce and stuff that's detoxified out of our body, or out of the bloodstream, and then moves it into these lymph vessels, which goes to lymph nodes, and then ultimately gets put back into circulation. But to help that lymph move around, we can do things like rebound. So I know that Rhonda was talking about this with the rebounder and jumping on that, because just the process of jumping up and down on that helps move things around, but then also just muscle movement in general. So when you contract the muscle, it squeezes the area, and both veins, which returns blood to the heart, and lymph vessels are one way. So they have valves. So it can go one way up towards the heart, but it can't go backwards. So as you're squeezing the muscles against those lymph vessels, it's pushing the stuff in one direction and helping it move back towards the heart, where eventually it gets dumped back into the bloodstream and then gets filtered by our liver and kidneys, etc. We definitely want, so that fourth one there, daily bowel movements. So that has to happen, because if we're binding up all that junk, both the chlorella is staying in your digestive tract and it's not leaving the body, then it can sit there. And one reason why the chlorella is important is because as things move through our digestive tract, our large intestine and small intestine will reabsorb some of that stuff. So the chlorella is there to prevent it from reabsorbing by staying bound to the chlorella. But then also we still want to get rid of all that stuff, because if it sits there and you're constipated and it just sits there for 2 or 3 days, it will still reabsorb to a certain extent back through the colon wall and then get back into the bloodstream, making your detoxification systems having to work even that much harder. And then, yeah, so the question here is we have with the chlorella, it is the stuff in the pouch, and it's vacuum sealed really tight. So, but they're in there. There's 1,000 of those little tablets in there. And then the final one here is sleep, especially for the brain. So this is when the brain clears out plaques and clears out other junk that forms during the day while we're awake. So sleep is super important for detoxification, especially when it comes to the brain. So there's many pathways that our body gets rid of this junk, gets rid of the toxins, and we covered them here, but it's to urinate, so we can pee it out from stuff that's filtered out through the kidneys. We can get it out through bowel movements. So that's as we're detoxifying stuff through the liver, it goes into the gallbladder in bile. And then when we eat foods, the bile is squirted out into the digestive tract and then ultimately bound up with the chlorella and then carried out with the bowel movement. Sweat, we do, and they've done studies on this where they've measured the amount of metals, heavy metals, and minerals in sweat and electrolytes. So that's why we want to replenish our electrolytes every once in a while by using a little bit of sea salt or using an electrolyte supplement, or just drinking regular water that's not distilled, because we want to replace those as we're sweating them out. But we do get rid of heavy metals through our sweat as well. So sweat, urination, and bowel movements are three main ways that our body helps get rid of that stuff, and probably to a little bit of an extent out through the breath as well. And again, it's not all about the supplements. We want to focus on foods. So a common question I had from people as we were promoting this program is like, what do we have any special diets? Are we going to be doing smoothies or anything like that? And there's no real specific diet to follow other than things that we should be doing all the time, just eating lots of whole foods and avoiding a lot of processed foods. So you want to eat more of, I mentioned it before, cruciferous vegetables, because they contain those sulforaphanes that help with liver detoxification. So your cruciferous vegetables are your broccoli, cabbage, kale, Brussels sprouts, etc. And then eating a lot of the allium family veggies. So that's your garlic, your onion, many herbs, things like turmeric. Then you have beets, lemons, blueberries, apples, and then your clean protein sources, healthy fats, fiber-rich foods. So clean proteins, I mean, that could be your grass-fed meats, your wild Alaskan salmon, ideally. But if you don't have access to those or can't afford those, you can also just aim for more lean proteins, because usually a lot of toxins are stored in the fat of the animal. And by healthy fats, we mean things like olive oil, avocados, nuts and seeds. And then you want to avoid processed foods, excess sugar, alcohol, heated seed oils or seed oils in general, gluten-containing foods. So we usually find those in our processed flour products. So your cookies, cakes, pies, etc. You don't want a lot of foods with a lot of additives, with artificial colors. and preservatives. And then you want to avoid in terms of your personal care products. You can go to a website called EWC, Environmental Working Group, or EWG, and you can either scan products while you're in the store or check some of your favorite products, and it'll give a grade like A to F on whether it's A is good, very low amount of toxins or toxic exposure from those products, all the way to F, where they might have some not so good stuff in there. Things like perfumes, other fragrances like the Glade plugins is a common one. And then just plastics in general. So heating, microwaving in plastic dishes, cooking with nonstick pans. I know there's some newer ones they say are okay. I'm skeptical. I tend to like the enameled cast iron. I think is the safest in my opinion because that enamel is pretty inert, and as long as it doesn't chip off or anything like that, that's not going into your foods. Cast iron's okay by itself unless you have tendency to have too much iron in your system like I do. Then using plain old cast iron might not be the best idea, but otherwise cast iron's probably okay. Aluminum, aluminum couldn't be toxic and cause things like early onset dementia and Alzheimer's, so that's a little bit of a question mark. But aluminum is relatively safe, I think, to cook with. It doesn't really leach out, to my knowledge. But if you want to be the absolute best, I think enameled cast is probably your best bet. So here I already mentioned already. So at EWG, Environmental Working Group, you can look at some health and beauty products and see if you're using ones that are good, or maybe you should look at some alternatives. We can use filtered water. So we have municipal water in Orgsburg, which is fairly safe and clean as far as I know. But we use an inline filter you can get for, I think it's like a couple $100 on Amazon. They're supposed to last 5 years. And you just go underneath the sink and you unscrew the one end. You put it onto the filter, and then the other end goes to the line that goes to your cold water supply. So pretty much every time you're using the cold water, it's filtered. Or you see a Berkey here is a type of filter, and there's all sorts of different filters out there. There's like things like Brita and stuff like that. You can get a whole house filter if you really want to, but there's various options there. We like our air filters, so you can filter the air as well, so you're not breathing in stuff. And we tend to like the Austin air filters. They're good for 5 years before you have to replace them, and they're a little bit pricier up front, but the filters last longer than most others. Like the Air Doctor there pictured, they're probably close to the same price. They might be a couple $100 cheaper, but if you look at the recommendations, I think you're changing filters either every 6 months or every 12 months. And then you're going to spend a couple hundred each time you change one of those filters. But having anything is going to help. And if you have a whole house like HVAC system, just make sure you're replacing those filters on a regular basis and check those so they're not caked with lots of dust and dirt and stuff like that. All right, so back to the supplements, just to go over how to take those. So first couple weeks, we're going to do the broccoli and the chlorella only. So especially if you're sensitive to things, I would start with the broccoli sprouts first, just one capsule for the first day or so. If you don't notice any side effects, which I don't expect anyone to really notice any side effects with this, then you can increase to 2 caps, and you can build that up to twice daily. And then after like 3 or 4 days, you can add the chlorella in, starting with 5 and 5, and then building that up. And again, there's going to be a whole printout that I'll send everyone after this that has a schedule with these. So that's just those two for the first 2 weeks. And if you notice any side effects at all, again, this is pretty gentle, so I don't expect anyone to have any side effects. But if you do, reach out and we'll address that then. But most of the time, it's just, all right, if you started with 5 capsules of chlorella twice a day, you increase it to 10 and you notice like maybe a little bit of stomach upset, or maybe you had a little bit of breakout in your skin on your face or your forehead or something like that. All right, maybe just back it down and stay at the 5 and 5 for a few extra days and then try to increase it to the 10 and 10 before moving on. If you react to anything, I think it's going to be the cilantro because that does move heavy metals around. So you want to start, it's a dropper form. You want to start with just 5 drops twice a day. And then you can increase slowly to 10 to 15 drops, or at that point, I think it's a whole dropper full. And if you notice any major side effects, like you might get a little brain fog, you might get a little anxiety, maybe you might like break out a little bit somewhere on your skin. If that happens, then just back down the dose. For people that are super sensitive to things, you might do the 5 drops starting in the beginning of week 3, and you might have little symptoms. Well, in that case, and if you know you're sensitive to a lot of things, you might just want to skip a day until those symptoms go away, then try the 5 drops again, or even less than the 5 drops, and then just increase super slowly. And to help with that, so as we're moving things around with the cilantro, the chlorella binds it. So we want to take the chlorella, I would say about 30 to 60 minutes. You really only need to take it after the cilantro, and you'd probably be fine there. And then try to be consistent with it. So the supplements that you have, the three that you bought or may buy, it should last about a month to 6 weeks. The cilantro will probably last months because we're only using a little bit at a time. And then that's something you continue to use until you run out. If you need more chlorella, the chlorella is, like I said, there's 1,000 tablets in there. So that might last you a little while too, depending on how quickly you ramp up to the full dose. But if there's anything that you take that you replenish, I would say the chlorella, especially if you still have some of the cilantro left, or even get the broccoli sprout as well. For a lot of you that have really minor symptoms, you don't have too much going on, you might go through these first 3 supplements, one package of each, and just take them till they run out, and you're good. For others, I see the people on the list here that's watching live now in the webinar. Some of you have some more severe issues. If you follow this and you get near the end of the supplements and you're running out of any of these, and up to that point, you notice that you've seen some pretty positive improvements and you've had issues for a long time, this is something that can be safely followed for 3 to 6 months or more. And this is what Dr. Klinghardt was talking about. People, especially with mold mycotoxin illness, chronic Lyme disease, where they've had problems for many, many years, they'll just follow this long term. Now, I wouldn't necessarily take 40 of the chlorella twice a day, but I might back it down to say 10 and 10 and do that long term, for instance, instead of taking the really high dose. All right, so I'll send this over, this PDF, and you'll have a 4-week tracker. You can print it out again and use it for more than 4 weeks if you want, but it'll have like the beginning ramp up, like 1 cap twice a day, then 2 caps twice a day, and so on and so forth. So it'll walk you through exactly how to do that. And here's a detox bundle, as most of you have purchased. If you haven't purchased yet, we'll still offer it for a special price, $189. And if you need that, you can reach out after this webinar and let us know, and we'll reserve these 3 for you to get started. All right, you all are here live, so you guys have already joined. But if you're interested and you're watching this at a future date, just go to peakmeddetox.com and you can purchase the supplements, and we'll get them to you. You can pick them up at the office, or we'll mail them to you. If you're out of the area, we'll send you the PDF guide. And then once you get the supplements, you can start them up right away and follow the plan. And then anytime if you have any questions, you can reach out to us and we'll take care of you. All right, and thanks for watching the webinar. If you guys have any questions, you can type those in the chat box here if you're watching live. If you're watching the replay, you can go ahead and reply to the message that you received this webinar link in, and we'd be happy to answer any of those questions. And with this, just take it slow. Again, if you're sensitive to a lot of things, or you've had some more severe health issues more recently, or you've had them for a long time, you're going to want to start slow. You don't have to race to get to the max dose and follow that supplement plan that's going to be in the PDF. You don't have to follow it to the T. If you have any major issues at all, you can just back that down, skip days. So it's work at your own pace and customize it to what you need. And then it's just all about just letting your body heal. Your body will take care of itself most of its time. Sometimes it just needs a little bit of help. And that's what this particular detox program is designed to do. Just give it a little bit of help. It's not harsh. It's not, you're not going to notice anything. So people are always worried to say, hey, I'm traveling this week. Am I going to be running to the bathroom all the time? That's not that type of deal. It's not a colon cleanse. You're not going to be running to the bathroom with any urgency like that. It shouldn't be any change on your normal bowel movements. If anything, the chlorella may bind you up a little bit. So if that happens, just make sure you're drinking plenty of water, making sure you're getting your movement in, doing all the right things. If you're still doing everything just right and you're still having problems, reach out, and we might want to add a little magnesium, maybe a stool softener, but we can take care of those issues. So with that, I'll answer the questions I'm seeing show up here in the chats. Otherwise, if you're good, you're good. If you haven't purchased this yet and you want to, go ahead and reach out to us and we'll get you a kit. And let us know how it goes. So if you run into any problems along the way, let us know. If you feel better, let us know, and we'll see how everyone does, because it's the first time we're doing this detox as a big group like this for our practice. All right, questions. Do I have to stop any of my regular supplements? I would say no, unless you want to take a break for a while. Like if you're taking supplements that you know help you, like a vitamin D, for instance, if you know your vitamin D is low, keep taking that. If you're taking a lot of things, like if you're on another protocol with us, for instance, and you want to take a break for a month or so while you're doing this detox program, you can. You don't have to. It's just a matter of, is it too much to take at one time? So with these, especially the chlorella, you want to take them separate from all your other supplements, medications. The chlorella probably won't bind. Like I mentioned earlier, like activated charcoal definitely would, and we want to take them at the same time. But just in case, you want to try to take the chlorella away from pretty much everything else. Next question here is, I take a lot of supplements for Hashimoto's. Do I continue all of them? So kind of like it's my same answer there. You can, or if you want to take a break from some of them, you can as well. It's not going to interfere with anything. So it can be done either way. There's no right or wrong way to do that. So the saunas, yeah, great question. The question is, could you elaborate on sauna, steam versus infrared? I would say if you're getting a good sweat on, then it's working. And I know there's some different benefits to infrared, and there's near infrared, far infrared. Is it a steam sauna? Is it the red lights or infrared sauna? My personal opinion is if you're getting hot, you're sweating, it's doing its job. And you'll get all the benefits of sauna for that matter. So if you're in a steam sauna or even a dry sauna or infrared, if it's if it's raising your heart rate, you're going to get the cardiovascular benefits. If it's getting you to sweat, you're going to get the detox benefits. And if it's hot enough to where you're getting to the point after 20 minutes to where, man, I don't know if I can stay in much longer, you're heat stressing your system. And that has even additional benefits above and beyond the detoxification and the cardiovascular benefits. You get something called heat shock proteins. So a lot of the benefits associated with sauna are because of those heat shock proteins. So that if you're getting to the point where your body is a little bit stressed, and in this case it's a healthy stress, it's kind of like exercise. So you're exercising, you're forcing that muscle to do work harder than it's done in the past. That stresses the muscle. The muscle responds by making itself stronger. So same thing here. You heat stress your body or cold stress your body in terms of the cold plunges and stuff like that. But having a little bit of that stress on your body helps it do something to build it and make it stronger. So anything I should watch out for in my breastfed baby with the detox? So the chlorella for sure is safe during breastfeeding, and the broccoli sprouts will be as well. The cilantro I may not add. I might save that for later, or start with really low levels and or wait till you're done breastfeeding. And if you have any questions about that, Kristen, I know is breastfeeding now as well, and she looked into all of this, so she'd probably have a better answer for that than I do right now. But symptoms might be, and we usually see this when people are doing some of the wrong things, like if they're eating a lot of sugar, or one mom was drinking a lot of Gatorade, like the full sugar Gatorade, and her baby was like breaking out in rashes all the time. We removed the excess sugar from her diet, the baby got better. So if you see anything change like that, like rashes, if they're colicky, if they're more irritable, if they're not sleeping as well, so things like that, if there's any change like that, then maybe it's being affected by this detox, and then I would stop it until you're done breastfeeding. Another question here, any medications that it will interfere with, except for thyroid meds? I don't think, but for that, to be safe, I would take the binder, especially away from, I would take these supplements away from your medications. Because hypothetically, the broccoli, I don't think would interfere. Because the problem with supplement medication interactions, it's usually because of the effects that that supplement might have on the liver, because some meds are either activated or deactivated a little bit through the liver. And if it's the same pathways that are affected between the supplement and the medication, it can either increase the effects of the medication or decrease the effects of the medication. So with these particular set of supplements, I don't think there'll be anything that'll interfere. But like if you're monitoring your thyroid and you have thyroid meds and your thyroid seems off, then it may be interfering, and then all you do is just stop taking the detox supplements. Or if you're taking a blood pressure medication, for instance, if your blood pressure starts going up, it's really high all the time, then all right, maybe there's some interference there. I don't expect there to be in this case. Right, next question. What type of magnesium do you recommend if it's needed to help bowel movements? So the best magnesium to use for bowel movement specifically is magnesium citrate, because that's less easily absorbed along the digestive tract, meaning more makes it to the colon and then pulls in water from the outside tissues, allowing the bowel movement to happen a bit easier. Because normally we'd say we want other types of magnesium, but specifically for bowel movements, the citrate works the best. But any magnesium form that you take orally will work eventually if you take enough, because it won't all absorb in the upper part of the digestive tract. It'll make it to the lower part. Vitamin C will do that as well. So if you take a couple thousand milligrams of vitamin C and do that every few hours, eventually you'll get to the point where your body won't absorb as much of the vitamin C, and it'll have the same effect by pulling water in and usually making the bowel movement easier. So I would start with the magnesium first. And if you're breastfeeding, you just want to double check and see if there's any interactions there with breastfeeding. I don't think there will be with magnesium or vitamin C, but you'll want to double check that and reach out to Kristen if you have any questions. So if that is all the questions, then good luck with the detox. Follow it, and then I'd love to hear your feedback and if you notice any differences. And regardless of whether you notice much, again, this is a really gentle detox. It's doing something. So the chlorella will bind. The broccoli extract supplement will increase or enhance phase two detoxification in the liver. And the cilantro will be a gentle chelator to pull those heavy metals out of the tissue. So you will be doing good regardless of any major effects that you might feel. This is probably something I'll do probably once or twice a year from here on out, just to kind of clean things out. Maybe we'll do it every spring. Good spring cleaning, so to speak. So, all right, everyone, have a good night and thanks for watching. We'll see you in the next one.